So who is at most risk for COVID-19 and why are they at risk?
I think, at this point, everybody is at risk of getting the infection, right? The question really is who is getting, who's ending up in hospitals, who's ending up on ICUs, and the deaths that we are seeing, and what age groups are you seeing them more? Um, I do want to point out that we have seen a lot of data come out where the people who have died are actually young and healthy. There was a report out of China that 60% of the patients had some underlying diseases, but 40% did not. So I think that is kind of like a common misconception out there that I'm young and healthy and nothing is going to happen to me. I've seen reports from a lot of the ICU docs in the groups that I am in, where there are several cases of young, otherwise healthy people getting, very severe disease, mostly related to acute respiratory distress syndrome of the lungs. I do agree with Dr. Vo that kids do seem to be protected. The mortality rate is so far lowest in the kids, and that is pretty consistent from the reports that we have seen from, across the countries. I do think that our healthcare workers are actually the ones that are very susceptible at this point because they will most likely come in contact with COVID-19 positive patients multiple times. Whether healthcare workers end up getting more severe disease than general public, it is still to be seen. But because these are the people actually taking care of the sick ones that end up in the hospital, I do think more of our effort needs to go into protecting our healthcare workers from getting the disease, which basically means more protective equipment, more sensible policies on patient flows, and some rapid early testing, as well as maybe some trials for treatment and prophylaxis that need to be happening for our healthcare workers.